Hey everyone, welcome back to my channel, and if you're new here, welcome. My name is Melissa and my channel is all about psychiatric drug withdrawal, reactions, and recovery. I had a very long and painful journey myself, first from SSRIs that I took long-term and then a disastrous reinstatement, which included adverse reactions, polydrugging, benzo use, and then a subsequent withdrawal, and it was the most painful experience of my life. If you're interested in checking out a more detailed version of my story, I have made long form videos on that you can find on my channel. I also have a little bit more of my bio on my website, which I will link in the description of this video. I am doing one-on-one supportive coaching for those who are looking for it. I have lower rates than other places you might find online. I offer a free 15-minute consultation, 30-minute calls, 60-minute calls, and then I've put together 4-session packages for people who might want to meet a little more regularly, and that is at a further discounted rate. I will put the link to my online booking calendar in the description of this video, as well as my website, and if you have a single question, I will post my email address as well. So this video today is going to be about programs that claim to cure symptoms, reverse symptoms, help you get through withdrawal, protracted withdrawal, whatever. I'm going to be talking about a few of them generally and sort of specifically. I'll get into what I mean by that in a moment, but the most common ones that come up in questions at me, either during coaching calls or as comments on my YouTube videos, and even I've read about this a lot on the forums, so things like DNRS, which is dynamic neural retraining system, I believe is what it stands for, the Gupta method, neuro-linguistic programming. There are also programs out there, courses that claim to reverse or cure or stop tinnitus, which can be quite a distressing symptom for people going through withdrawal. I'm just going to address that here. So it's kind of a loaded question, and I will try to keep this as short and succinct as possible. So my own personal philosophy, and I've mentioned this in other videos, is that when you're in the acute phase, and the way I define acute is when you are in symptoms 24/7, you don't really get reprieve, things are very intense. It's typically on average, now this is just very much an average, 3 to 6 months for people. Now, I call the time after acute, subacute, and then protracted. So I divided into 3 different sections. I consider, again, acute when symptoms are 24/7, typically 3 to 6 months. Subacute is maybe when you start to get a few windows. It could be 1 hour in the evenings. It could be a few hours in the evenings. It could be the odd day here and there. And then I think protracted is when you're about 2 years off meds or 18 months off meds and beyond, and you're still symptomatic. So that's how I define things. So when you're in an acute phase, I don't personally believe that those systems or those programs really can make a difference. So for myself, long before I ever took psychiatric drugs, which I initially took for job loss. When I got laid off, I was not mentally ill. I was going through depressive symptoms, but I don't believe I was clinically depressed, and I was put on antidepressants for that. Now, I have suffered from different varying levels of anxiety and OCD symptoms since I was a very young child. They did hit a peak when I was about 22, and at that time I had never taken a psychiatric drug. And so I did cognitive behavioral therapy on myself and exposure and response prevention therapy on myself as well, self-directed. I'm a very self-motivated and self-directed person. So I found really good information. That was before sort of the online Googling days. And I essentially cured myself. I would say I was 90% cured, and I lived a very drastically different life after the discovery of these therapies and techniques and coping skills. It really eliminated most of my anxiety and OCD symptoms. And then several years later is when I got put on psych drugs for job loss. And so I was pretty well versed in how to deal with anxiety and OCD type symptoms, fear responses. What I used was similar to the Claire Weekes method. Although I didn't know about her at that time, but the methods I used were similar. So it's like an accept and float. It's also similar to the DARE program, if you're familiar with that. It's basically like understanding your symptoms at a fairly deep level, understanding that they won't hurt you, and then accepting them and floating with them. So you're not resisting the anxious symptoms. You're not trying to combat them. You're not always trying to cure them or fix them. You're just like, okay, this isn't going to hurt me. I'm going to accept these feelings of bewilderment or dizziness or panic or whatever, and I'm just going to allow them to be there, and then they will pass naturally. That's kind of the basic concept of it. So when I went into withdrawal and did not know that that's what was happening to me after 7 years of SSRI use and an only 4-week taper that I was put on by my doctor, I started having a lot of symptoms of fight or flight, fear response, panic attacks, sobbing, and, intrusive thoughts, and all kinds of things that go along with the fear response and anxiety problems. And so I was like, oh, okay, I don't understand why I'm suddenly getting these symptoms again after being asymptomatic for a very long time, but I'm going to put my old techniques to use. So I got out my old books and all of the things that had worked for me in the past before drugs, and nothing was working. And so I'm like, what the heck? Like, I'm putting these into practice constantly and nothing is making a dent in my symptoms. And it was only when I was 8 months off my first SSRI that I realized that withdrawal syndrome was a real thing. I had not heard of it before then. I clearly was not provided with informed consent when I was prescribed these drugs, like most people are not, but I couldn't understand why none of my techniques were working. Excuse me. And then it all made sense to me once I discovered withdrawal. So my personal belief with all of these limbic retraining programs, NLP, all those things, is when you're in an acute phase, they just don't work. I think the effects of the drugs, the chemical changes the drugs have made in your brain are overpowering your ability to, it's not even mind over matter, it's really retraining your brain to not have those fear responses based on bodily symptoms, mental symptoms, whatever. So, but I think when you move into subacute and protracted, these things can be beneficial. I personally have not done DNRS and NLP, Gupta, what's the other one, that I had mentioned before, I can't even remember now. But I'm aware of them, and I have clients who have used them, and I've read lots of stories of people who have used them with success. Typically, like the limbic retraining, as far as DNRS goes, a lot of the marketing for that is more like chronic fatigue syndrome, ME, multiple chemical sensitivities. I can't remember what else, but they are symptoms that people in withdrawal go through. And so again, I have heard success stories of people using these programs to get through their withdrawal, and so I'm not against them at all. And I can't speak to all of the details, but I think the overlapping, or what I see as overlapping between some of the programs, is acceptance of symptoms and training your brain. I don't know if it's at a conscious and subconscious level, not to react to the symptoms, or not to react to what's going on in the body. So I do think that they can be beneficial for people in a subacute or protracted phase. But I want to speak specifically to, so there's a guy that I found on Instagram who claims to stop tinnitus, and he claims that stopping the tinnitus is his methods work no matter what started it, whether it was noise, trauma, whether it was an autotoxic medication, which is what benzos and antidepressants and psych drugs would fall under, whether it's from, I don't know, there's all different, like long COVID, all of these different things. And so I was really intrigued by his social media posts. So I found his course. It wasn't super expensive, and I purchased it, and I went through the whole course in one day. So it was bad. I was up super late in the night. I just wanted to consume all of this information, and I found it quite interesting. Although it was very strange because his course is digital, but a lot of it, or what you really need, is this physical book, which he's like, oh yeah, as soon as you order the course, I send it out to you in the mail. I believe he's like in Thailand or something. So he says, okay, it might take a while for the book to get here. I have not even received the book, and I purchased the course almost a month ago, but I know we were in the holiday season and stuff, so I'm assuming that's the reason for the delay, or maybe it's not even delayed since it's so far overseas. But anyway, the premise of the program is tinnitus results from mitochondrial dysfunction. This is his theory, and he sees, he has a crazy amount of testimonials, and so it really intrigued me because I'm a real believer in reviews and independent reviews. So I looked into him a lot, and of course there's some people saying he's a quack, but there's all these people who have claimed that they have reversed their tinnitus using his methods. So the general overview is he takes you through basically this questionnaire that lets him determine which sort of pillar is the most problematic for you. So he goes through, when you go through this questionnaire, he asks you questions about toxicity, stress, diet, EMF exposure, which I've talked about relating to tinnitus in some of my videos. There's some other ones I can't quite remember, but I think there's about 6 or 7 pillars. And he said these are all involved in tinnitus, but some of them are going to be more problematic for you than others. And that's what we want to focus on reversing. So for me, what came up was diet and EMF, which I'm not surprised because I just have figured out through, my time living with tinnitus that EMF makes it worse. So I had pretty much either not noticed my tinnitus at all anymore up until 2 months ago, or if I did notice it, it was very brief and it never ever bothered me at all. Although, I have claimed that I'm 90% recovered, and that is the case for me. But then I got hit with COVID in November and my tinnitus came back, and I've been really honest about that, or maybe it never left in the first place, but it was pretty much gone, but it came back and it became more constant after I got COVID. So this is what interests me in this tinnitus course. Plus, I have clients whose sole problematic symptom is tinnitus. So I was really interested in this man's claims. So anyway, he said according to this survey, my problems are EMF and diet. And so then he goes through these like sub pillars, he calls them, or sub dominoes. That's what he calls them, because he claims it's like a domino theory. And he also claims that tinnitus is just like basically your problems in your body were building up over a long period of time, and then there was just a catalyst, whether it was noise trauma or benzos or whatever, or the cessation of psych drugs, and it results from this mitochondrial dysfunction. And so the sub pillars under EMF is like use blue blocking glasses when you're staring at a screen, limit your EMF exposure, don't put your phone in your pocket when you're carrying it around, don't use wireless Bluetooth headphones, which I use a lot. And then the diet, like there's all these different facets of upping your vitamin, like vitamin and mineral deficiencies, like intermittent fasting, dry fasting, like there's all these different parts of it. Now, he does claim that in his physical book, there is a lot more detail, which I still haven't gotten, so I can't speak to exactly what it is, but he says that the root of a lot of this is like stress and inflammation. And I've talked about that in other videos before as well. He claims that he had like suicidal level tinnitus for 4 years, and he has been completely living in silence for 6 years now. So I find it very interesting, and I have not, it's quite rigorous what he says you have to go through in order to get relief from tinnitus. So I haven't, and because I don't have the physical book yet, I have not started any of this, nor will I be able to do it as rigorously as he, I guess, says you need to, just because of my situation with working and being a single mom and all these things. But I am interested in implementing some of it once I have all of the details. So I can report back if that would be interesting to you once I get the book and have read it through front to back. Now, there is another method that someone had commented on one of my videos a while ago that I didn't really give much thought to, but it's come up again, and I've been looking more into this, and it's the Mindbody Syndrome. So if you're familiar with John Sarno's work, he claims that chronic pain is a learned behavior. So whether you had whiplash or some type of acute injury like a fall, the acute should only last a few days, and then anything beyond that is a learned response. So that's hard to grasp, but in his book, The Mind Body Prescription, he does get into a lot of different like studies and things that back up his claims. And there are videos on YouTube of people in protracted withdrawal or who have gone through protracted withdrawal and only cured themselves of all the symptoms permanently using the Mind-Body Syndrome. So the premise of the Mind-Body Syndrome theory is that repressed emotions are at the root of chronic pain and chronic syndrome. So this has been brought up lately with long COVID, protracted withdrawal, and chronic pain. All of these are, again, things that TMS claims to be able to cure or reverse. So I guess like without going into a lot of details, I have read John Sarno's book, and I have watched videos of people claiming to reverse their protracted withdrawal with this approach. And what you're supposed to do is, because I misunderstood it when I first heard about it, and I was like, this is way too Freudian for me. I went to school for psychology. I was not a Freudian type thinker. I wasn't really a big believer in the psychoanalysis and all the subconscious or unconscious, like repressed emotion theories. And so I was like, I wasn't really open to it. And I was like, when I'd first heard about TMS, I was under the impression that you always had to be bringing these repressed emotions to the surface and like allowing them to all come out in order to heal from whatever you're trying to heal from. And I misunderstood it because I'm like, well, everybody goes through stresses in their life that could end up, repressing unconscious emotions. And most people have had some level of trauma or a lot of difficulties in their lives. So does this mean that your symptoms are always going to come back if you're experiencing life stress? Like, do you have to live like a monk in order to heal? And that's not what it says at all. It basically is like, these suppressed emotions, which can turn into rage in the unconscious, it's too painful to bring them to the surface, so your body finds ways of diverting from those painful emotions by manifesting physical or psychological symptoms in the body. It sounds really crazy, but there are a lot of stories and long COVID, long haulers, whatever, with success using this method. And so what you basically do is, there's workbooks you can follow, or you can just do this basic thing where it involves like meditation and stress reduction, which comes up in almost every technique that there is, every brain training program, but also expressive journaling. So kind of there's guided ways to do this, and then there's just sort of a general thing where it's like, what did I go through today? How did I feel? They talk about how even positive stressors can cause this like suppressed rage. So even if you have a baby, which is supposed to be this joyous experience, you actually harbor this rage because your life has been, what's the word? Like, there's been like this upheaval in your life because suddenly now your life revolves around your child and you have no more time for yourself. And so this causes like unconscious, repressed, suppressed rage. It sounds crazy and far out there, but when you read the book, it makes more and more sense. It's hard to wrap your head around though, because we're not really taught to think that way, and it can seem really far out there. So basically you do this expressive journaling, you basically take inventory. So when you're in a wave, which he calls a flare-up, or people who have referred to this call flare-ups, that just means that you're in some type of stress state that is causing these repressed emotions. So you do this journaling to get it all out there. You don't have to bring the actual rage to the surface, but you have to you have to express your emotions through journaling. Again, I haven't done the actual exercises, but this is the basic premise. And, it can be very effective for relieving these physical symptoms because they claim the brain is always trying to divert from these painful emotions, and it does it very cleverly through physical symptoms. So when you become aware of what's going on in your body with whether it's pain or protracted withdrawal symptoms, it's just a diversion. And once you can kind of face the stressors in your life and work to reduce them and express them, the physical symptoms go away. So I have seen pretty incredible healing stories using this method, although again, I haven't actually put it into action. I just finished reading this book yesterday and really grasping the concepts. And it is a lot to sort of wrap your head around, like I said. So yeah, it's expressive journaling, and some part of it too is speaking to the unconscious. So I think this overlaps with some of the DNRS type stuff. Correct me if I'm wrong, but you basically say, okay, brain, I realize you're creating these symptoms to divert me from something. Thank you for trying to protect me, but I am safe. I am okay. Your diversions aren't needed anymore because I'm dealing with my pain or whatever, my emotional pain. So that's sort of like, you can shout at the unconscious, you can say things out loud, or you can just think them. I had read this book when I first went into withdrawal the first time, called The Power of the Subconscious Mind, and it talks a lot about these types of things as well. And I have to give some personal opinions on some of these things too. So I do believe, so this is just my personal opinion based on my almost 6 years in this arena, so to speak. I do think that there is more going on than just withdrawal. I mean, I've expressed that before, because to me, reinstatement would always work if it was just withdrawal. And in fact, it often creates further worsening problems, and people have adverse reactions. There's the whole kindling effect. So obviously it's not straight withdrawal. Also, it doesn't make sense to me, just on a very logical level, that some people can have no withdrawal even after decades of benzo use. Some people have a 6-month recovery period, and some people are, many, many years down the line, still symptomatic. I do wonder, of course, I have to address if, and I have seen it before, where some people who are protracted are not sharing their full story, especially on the forums. They are taking like black market drugs. They are, drinking alcohol. They are buying benzos online. They are sort of dabbling in different psych drugs, but they'll be like, oh, I only took it for a week, so it's not affecting me. Antipsychotics or anticonvulsants or whatever. And I do think that complicates the situation and doesn't give the clear picture if you're just telling people on the forum, well, I'm 5 years off and I'm not getting any better. I do think that that does occur, but I also think that there's more to it, because if it's just a thing about, because there's this whole notion online about how the GABA or serotonin receptors, whatever drug you took, get down regulated. I believe that's the correct term. And when you take the drugs, and then when you pull them, all of these receptors have to upregulate, unless I have that backwards. But that's like one of the general theories. But the problem, in my opinion, with that theory is that why does someone have no withdrawal? The next person has a 6-month period, and the next person is like 10 years out and they're still not feeling better. It could be that they're still taking other things in the meantime. I definitely see that happening, but to have such a wide range of recovery timelines, I do think that there's more at play. We are humans, we are complex. Our brain and nervous system is very complex. So hear me out on this one. So I'm a diabetic of almost 26 years, type 1. I got it in childhood. It's a pretty serious disease, especially type 1, and diabetics are known to be slow healers. So if you get a cut on your foot, a diabetic typically will have a much longer recovery period than a non-diabetic. However, it's not like a 10-year wound healing. Typically, it's more of a smaller range. So say the average person takes a week, a diabetic might take a month or 2 months, but not 10 years. So I'm just like, I don't really see how there can be that wide of a discrepancy in healing the same issue. And then why do some people not need healing at all? Meaning they don't even go into withdrawal. It doesn't really make sense to me. And I've talked about this in videos, maybe in a more milder way, where I've said, second fear, I do believe perpetuates. I'm not saying that you're creating the symptoms yourself. It's not a mind over matter thing, but I do believe that at a certain point, something is keeping the symptoms going. And it, again, it could be multifaceted. I don't think that healing from something, especially chronic, is ever just it's just like a one solution thing. And same with causative factors. Diabetes is caused by different things, type 1, that is. And things like autism and anything chronic, there's usually multiple causes. Same with cures or reversals. It's usually multifaceted. But I want to touch on the emotion and psychology or psychological part of it, just because, again, I'm saying that this is not a magic bullet, but it could be a piece of the puzzle. So when I started developing skin rashes, I've made videos about this. When I got COVID last month, never had skin issues in my life. I started going down those different rabbit holes of eczema and hives and all these things. And I came across people on social media claiming that they had cured their chronic eczema that they've had for years, decades, whatever. And what I noticed in people who cured themselves or reversed their eczema or whatever, and even people who have claimed, or people who have fully recovered permanently from their protracted withdrawal, I feel like I'm at 90%. I still will have triggers, and I've been honest about that. They all say that there's an emotional component. So, people who have cured themselves of eczema will say eczema is not a skin condition. They almost all say that. It has a deeper root cause. It's internal. There's, again, multiple different causations that can contribute to eczema. But in reversing it, they all say you have to do, some say inner child work, some say trauma healing, some say, mindfulness or stress, some type of meditative stress reduction. They all say that. And, I have to wonder because the more I dive into this, there's one YouTube video that I watch quite frequently of this woman who was hit. She was in a car accident and she was young. She was only in her 20s. She was a model actress and in Canada here. And she, the nerves in her back like hit her spine and she basically became disabled at that point. She wasn't in a wheelchair, I don't believe, but she was told she'd never work again. She was literally living on her grandma's floor. She was in chronic pain. She was taking narcotics, every day. She was documenting this and she was just sobbing all the time. And she was in such a high pain bracket, they assumed she was going to commit suicide. So she was mandated to see a psychologist. She was approved for permanent disability. And she's like, there's got to be a better way. So she ended up going to the self-help section of the bookstore for the first time in her life. And she bought these essentially like Mindbody Syndrome books, or like mindset to heal body stuff books. And she essentially cured herself. She's like this motivational speaker now. She's fit, she's healthy, and none of what she was told ended up becoming true. And I've also seen in people who claim to cure chronic things like eczema, like tinnitus, like different things, they say, you have to get out of the pain and the horror stories. Like I see this over and over and over. You have to stop perpetuating the fear cycle. Even if it's not something that was fear-based to begin with, or that you think of as fear-based, like eczema, you have to still get yourself out of that mindset of this is permanent, this is irreversible, I have permanent damage. I see this with COVID long haulers as well. And people who have recovered, they say you have to stop telling yourself, I have permanent damage, I have this virus lurking in my body that's destroying my organs. Like, again, I'm not saying that there's nothing physiological. Obviously there is, because a lot of people who go into withdrawal, including myself, didn't even know there was a withdrawal syndrome, had no idea symptoms could occur from stopping antidepressants, and were very symptomatic and were like, what is going on with me? So obviously something is going on. I'm not denying that, but I'm saying that things that last a very long time, I wonder if it's perpetuated by other things. And I've spoken about forums in my videos before and how dangerous I think they are. And I see this consistently in clients where they're using the same type of language. And it's like, protracted and permanent damage. And I don't know, like all of these things that to me sound like what the forums say, or, kindling, and I've screwed up my brain, and, this is it for me. Like there's no coming back from this, and it's like I hear this consistently. And that was my story for a long time too. But again, I wonder how much is like related to second fear, that everything you've read, all of the horror stories, telling yourself this is permanent and people don't come back from this, and this is, ruining my life. I wonder how much of that plays a role. So in this book, The Mind-Body Prescription, which talks about the Mindbody Syndrome, there was this one study of people who I think they said they needed some type of, they didn't say contrast dye like in an MRI, but it was X-ray, some type of X-ray solution or something they had to take in order to get an X-ray. I don't know what that would be. If you know, let me know in the comments. And these were people who had past severe reactions to this agent, whatever it was that they were giving these people for x-rays. And they changed the environment where they talked in casual language, like the researchers or whoever was doing the study, and they created a whole different environment, a calming environment, and the people had no reactions. And I think about myself, if you're familiar with my story, I had transcranial magnetic stimulation when I was in the thick of my withdrawal, and they crank up the pressure, or the how sort of hard the magnet is hitting the head every day or every other day. And the one day when they told me they were going to be doubling it or whatever, and they said, you might experience some pain, I was like, ow, ow, ow. And, I said, you need to stop. I can't tolerate this. And then the next day I go back and they give me the treatment, but they didn't say anything beforehand. And I didn't ask any questions, and I felt absolutely nothing. And afterwards they said, how did you feel? I said, great. And they said, okay, well, we did the exact same power as we did yesterday. or the day before when you couldn't tolerate the pain and you felt nothing. And they said, they were kind of chuckling, and so was I. And they said, we see this all the time, and we've learned that it's better not to tell patients what's going on. So again, it's the power of suggestion, the nocebo effect. If you expect or you know about side effects or the pain that something might cause, you're way more likely to feel it than if you don't know. So I just thought that was really interesting. And sometimes I think ignorance is bliss to a degree. Obviously, not in all cases across everything, because if we weren't ignorant to what was potentially going to happen with psychiatric drugs, we wouldn't be in this position. So again, it's a fine line, and I'm just kind of throwing out theories and sort of my personal thoughts on things and what I've uncovered in my years doing this and being in this space. So I just thought that was really interesting. And also I wanted to share, so when I reinstated at 2.5 years off and got adverse reactions, polydrugging, benzos, movement disorder, akathisia, everything, and was pulled off, I developed hypersensitivity to all kinds of medications. I couldn't tolerate anything. It was bad. And then when I was 15 months off, I had a baby. So that's a whole other story. You can check that out in my long story, and in my bio on my website. But when I had my baby, I was in a critical state. So I developed HELP syndrome, which is a liver problem and severely high blood pressure. It was a medical emergency. I was rushed by ambulance to the Children's Hospital 3 hours away at 34 weeks. And if I didn't have the baby that night, there was a good chance that me and the baby would die. And so I was like, okay, I had been through the most horrible pregnancy. It was really difficult. I had all kinds of complications. I was really the pregnancy shouldn't have happened in the first place. I had like a less than 5% chance of conceiving naturally because of my age and my history of chronic disease. So this was a miracle baby, and I had made it this far, and I was like, in my mind, I was like, I'll do anything to keep my baby and myself alive. And so I had a spinal block. I had antibiotics to have my C-section emergency. I had a hemorrhage. So I had like different medications that I had to take afterwards because we were in the NICU and in the hospital. Didn't have a reaction to anything. The only thing I had even a mild reaction to was Benadryl that they gave me before my blood transfusion. But 18 days postpartum, so I developed preeclampsia and HELP syndrome. I had massive swelling in my body, my feet, my hands, my arms, like my face. Everything was so swollen, and it caused some type of temporary nerve damage, and I was essentially disabled for the first 2 months of my daughter's life. Needed full-time help, couldn't shower myself, couldn't take care of my baby, couldn't breastfeed, couldn't do anything because my hands were completely numb, and the nerves that like innervate the muscles, something was not working because my hands were like weak and I couldn't use them properly. Like no doctor could really tell me why, but I was in such horrible shape, and I was so desperate to take care of my miracle baby that I convinced a surgeon to give me carpal tunnel surgery because I thought maybe that was the cause of my problem. So they gave me carpal tunnel surgery. I had steroid shots in my wrists. I had this surgery, numbing agents, whatever. And again, no reaction. And I wonder if it was because, my baby's safety and health and well-being and my own were like trumping any adverse reaction that I was like willing to do anything to take care of my baby and keep her well. And I wonder if that's what caused no reaction, because I had been reacting to everything before then. And I've reacted to things since then. I had a steroid nasal spray reaction this past summer at like 25 months off, or 26 or whatever it was, or 20, maybe it was 30 months even. And so I just wonder, I think that there is, other mechanisms going on. I've talked about histamine issues and mast cell activation syndrome. I still believe that can definitely be a factor in all of this, in COVID long haul, in protracted withdrawal, and this mind-body stuff. I really do think that there's something to it. Do I believe it's a magic bullet? No. Do I believe that you caused your symptoms? Absolutely not. Do I believe it's as simple as mind over matter? No. It's a complicated process involving the limbic system and programmed and learned and unconscious responses. It's by no means your fault. It actually is part of the human condition and the human response. I mean, you've been through a trauma, and there's stuff that gets repressed and suppressed, and yeah, I mean, a lot of people have rage against Big Pharma, their doctors themselves, God. I do think it might play a role. Again, I haven't put all of this into practice and I haven't done the full tinnitus thing, but I'll let you guys know if I do. And let me know your thoughts. Have you done DNRS? Have you done Gupta? Have you done NLP? Neuro-linguistic programming. Another overlap I see in these different programs is you're not supposed to talk about your symptoms because it gives them a voice, or it keeps them alive. So I don't know what you think about that. You're not supposed to be in the forums, you're not supposed to be doctor hopping, you're not supposed to be, in frantic fix it mode with some of these, and you're retraining your brain not to react. And I know with DNRS they talk a lot about multiple chemical sensitivities, which many people in withdrawal go through, sometimes very severely, reacting to everything including water. And if there was nothing to the brain retraining stuff, then nobody would ever get better using them, and they do. So there are some things that are within our control. It's not simple, it's still complicated and complex, but I do believe that there are subconscious and different, fear loops going on unconsciously that keep these things alive. So that's just my own personal thoughts. Again, let me know what you think and if you've done any of these programs and what your success rate was. I know a lot of them are quite grueling and rigorous. That's another thing I've noticed across these different programs. But I mean, again, this is the nervous system. It's very complex. And all these conditions are multifactorial, multi-causative, have multiple causes, and so obviously the solution isn't going to be quick and easy, as we have all discovered. So yeah, let me know your thoughts, and I hope you're doing well, and I'll see you next time. Bye.